main causes of those sickness. This again it is a trend that we've been seeing on a year-on-year basis, and again quite surprising. When we talk about the top three critical illnesses or things like that, it's always the diabetes, the cancer, the heart diseases of the types which come up. But here, right up with diabetes came anxiety and depression. So these are serious concerns and have increasingly becoming more and more serious concerns for our customers when we surveyed them. Of course, there's a whole list of other things which people are concerned about, but seeing anxiety and depression right up there as high as diabetes was quite a surprise. We've seen this increasing trend on a year-on-year basis, and now it is at par and amongst the top three concerns that our Filipinos have. Objective of this study? What did we get into this study, with in mind? First of all, we wanted to understand what is the current state of nutrition and wellness among Filipinos across various demographics and the socioeconomic profiles. Second, it allows us to understand what are the various factors that impact health and well-being, including dietary habits, lifestyle, access to healthcare, and medical expenditures. And then, of course, very importantly, examine what is the role that proper nutrition, healthcare access, and of course, financial literacy, which is extremely core to our business, is helping shape a better future for Filipinos. So, those were the objectives with which we entered into the study. We've already discussed this. I'm going to skip this slide. I'm not going to dwell on every slide, but try to give you the key messages which we are getting out of our research. So first key finding, and this was one of the findings which was quite surprising to me as well. Younger does not mean healthier. Did anybody hear about this before this? Because we typically always assume that younger is connected to being healthier. You're healthier when you're younger, and as you progress in your age, you tend to get more and more critical illnesses. Apparently, that's not true, and there is statistic which we found. This is what we call as total sick, which is the number of times that an individual has fallen sick in the last 12 months. And this is three. It's broken down into three aspects. One is sick but did not visit the hospital or any doctor, just felt sick. Second is the individual felt sick but did end up being in hospital or going to the hospital consulting a doctor. And the third way is the person was sick and stayed in the hospital. So if you combine all these three incidents in the last 12 months, on an average, an individual was sick 2.7 times. And surprise, surprise, the 18 to 29-year-old were sick 3.4 times in the last 12 months. The highest amongst all the age bands that we surveyed, which came to us quite surprising, which means that people at a younger age are starting to feel the pressures, are feeling the challenges, and are getting sick, in fact, more number of times than some of the elderly aged people in our study.